Hey, thanks for tuning in. Welcome to our podcast, Project Brightside, where we always look on the bright side, even when things are looking pretty dark. My name's Richard Brito, and I'm your host for today's episode. Topics of discussion for our podcast includes society and culture, education, and TV and film. Each episode will have an interview of a guest speaker, followed by a Bright Talk segment where we discuss a complicated topic in the hopes of shining a light on it. For today's episode, I will be interviewing the co-host of our podcast, Dr. Shelby. With that said, let's get started. Hey, welcome to the show, Dr. Shelby.
Hi, Richard. How are you doing today?
I'm doing great. I'm super excited for episode 2. We switched things up and I get to interview you.
Excited to be here. Definitely excited for episode 2 as well.
Yeah, so with that, let's get started. Who are you? Tell the audience a little bit about yourself.
So I'm Shelby. Yes, I was born in Washington, D.C., but I actually grew up all over. I went to Florida State University for undergraduate and medical school and did a 1-year master's at USF, which is University of South Florida. I'm now in my intern year for family medicine at my residency program in Georgia. I guess outside of academic stuff, some things I like to do are like reading, traveling, running, and then just kind of picking up new hobbies in general. I just started crocheting and pickleball, so like to do a lot of different things. I'm happily married to my husband, Phil, who was really a big part of this whole journey. And we actually met my first year of college at FSU. So,
Oh, wow. Nice. So, couple questions. What was your master's in? And you met him in your first year. So what did you get your bachelor's in as well?
yeah, so my bachelor's was in biology, and I had a minor in chemistry. We actually met in biology class. So he went wayward and is not doing anything related to science, but that's okay. And my master's was in biomedicine.
Oh, wow. So like that's college sweethearts. You guys met like your first year and then went on all the way and married now. That's amazing. I'm so happy for you. So
Oh, thank
another
you.
thing I didn't understand, pickleball? What is that?
You ever heard of pickleball?
No, what is
No,
that?
it's like I don't know. It's a sensation right now. It's like easy tennis. Although I feel like some of the, I don't know, bigger tennis players kind of joke about it, but it's cool because kind of anyone can play it. It seems sort of like a combination of ping pong and
Oh,
like tennis.
so it's like those tables and I have heard of it, but I just didn't recognize the name. Okay.
Yeah, it looks like a tennis court, but it looks like a ping pong paddle kind of.
Good to know. Thank you for that. So, thank you for telling us a little bit about yourself. So, what exactly are, you asked me this last episode, 3 to 7 core values that describe who you are.
I always have kind of a difficult time saying like positive things about myself or speaking outwardly about self-reflection, but I feel like the ones that I came up with that resonated most were empathy and compassion. Um, I think obviously there's compassionate people in
Hmm.
every field, but I think medicine definitely draws a lot of people that are empathetic. And then I think respect and honesty are 2 elements that are important to me, and they were also big parts of my upbringing with my Italian American mom. So
Yeah, those are great responses, especially like being a provider, that you are as a doctor in your residency, having empathy, making sure you protect that space. It's very important to not like, lead to burnout and whatnot. So I'm glad you chose those because many doctors tend to, lose that over the years. So I'm really happy that those are your core values. So what do
thank
you
you.
aspire to do in life?
So, I mean, in terms of my professional career, and this is a little bit vague, but I just really aspire to be a truly evidence-based and, still compassionate and knowledgeable family medicine provider. I'm really interested in practicing full spectrum care with a pretty diverse population. I have some interest in sports medicine as well.
Mm.
I think it's a really cool field, but I kind of love everything, hence the family medicine residency. But I also love learning and teaching, so I'm considering pursuing a career in academic medicine as well, which would be
Oh.
kind of working with academic institutions and teaching residents and medical students as well.
Professor Shelby coming up.
Maybe. I don't know. I like everything.
That's awesome. Being exposed to different fields, careers, like it makes life interesting. And you've always been that kind of person where you dip your toes everywhere in the sense of like you're multidisciplinary. You just love a lot of careers and you're talented with many skills too. So
oh, thank you. Yeah, I think teaching and learning are both things that, I really enjoy. And I feel like if I couldn't do anything in the healthcare world, I probably would have gone to, be a teacher or a professor.
oh, you're a very prominent leader in many organizations that you've worked on. So tell the audience a little bit about your leadership experience and what that consists of.
Oh, thank you, Richard. I feel like everyone's a leader in their own way, but in terms of, kind of specific named roles, I've had multiple leadership experiences across a few different clubs and organizations in my academic career. So one of the ones that was most important to me was co-starting the Global Health Collaboration Project. And we mentioned it last time because you were integral in starting that as well. But it's an initiative to implement Honduran-driven interventions, working on improving rural health in the area. And I am also the Chief Operations Officer of the Brightside Productions LLC. Outside of that, I've had a few different ones on committees and various clubs that have all been meaningful in their own way.
With being a leader, what would you say is your philosophy and style?
That's a great question. I would say my leadership style most closely aligns with participative leadership. I can't speak, but I think it falls along that most of the time. And basically, at least with patients, I'm a big believer in informed mutual decision making. And I think even outside of medicine, that can be really effective. So, basically just really getting the people that you're essentially leading to get their input and having them be active members in the decisions as well. So that's worked well for me so far. Not every leadership style works in every situation. So sometimes, we can adapt a little bit to different environments, but that's the one that I most closely align with.
Yeah, it definitely resonates to you because working with you, you always like engage in active listening. You're very empathetic in the sense that you could listen to the situation and empathize with them and provide solutions that are driven based on their expertise. Because, patience and, participative leadership, it includes making sure that you're having the focus on the actual patient and they're an expert of their own life experiences. And you take that into account by listening to them. So I totally see you as someone that does that and doesn't just, look at a situation and not really listen to the person. You really do take into account all the details. Just working with you throughout the years, I've noticed that. So
thank you, Richard. Yeah, I feel like we're here as physicians to to guide people and to provide expertise and provide our recommendations. But ultimately, I 100% agree with you that people are the experts of their own body and nobody knows what they're feeling or what's going on better than them. So that's definitely what I try to show through my interactions with patients for sure.
Amazing. Perfectly said. So what would you say are some keys to success?
Well, anyone can theoretically be successful. Of course, there are external factors like resources. Outside of those, I think the two most important elements of success are number one, just believing that you will be successful. I feel like, especially throughout this academic journey, but even hobbies like running, I was training for a half marathon, last year and the year before. And I think just the attitude change between being like, I have to go run, I'm never going to do this, and being positive, even if it feels kind of goofy, like I know I'm going to get there, like I'm already improving, and just having that kind of positive mindset and really believing that you can do it no matter what it is, I think is one of the biggest elements. I guess the
100%.
second, yeah, thanks. I guess the second one would be, the ability to overcome failures or letdowns. So nobody's path is perfect. And, there's always going to be that moment where maybe you slip in your diet or you don't get accepted to the program that you wanted. There's all these different things that can happen, and being able to separate that from the full picture and the full journey, and being able to know that you will still be successful and get through this. So, nobody's path is perfect, but being amenable to variations in the journey while still moving forward, I think is key.
Wow, you're like a philosopher. You know how to say things like so beautifully. I totally agree with you. Honestly, when you like resort to all these like challenges on a daily, it does make you sort of waver in your
Mm.
beliefs, but then you just have to like really resort back to that core. And, I love that you say that believing that you will be successful and changing that like negative mindset into a positive mindset, because we all have those fears, but it could cloud our judgment. It could cloud, it's all fear driven. So if we really push aside that anxiety and push aside those fears and resort to hope and belief of success, no matter what is thrown, like that's where you will succeed, because it does seem intimidating. Like, for instance, in my doctorate, you already finished your doctorate, you're in your residency, like you're doing a whole new beast. But I'm in my doctorate and I'm thinking like I'm halfway through. It's a lot. I at times feel it's challenging, and there are thoughts of doubt, but then I combat that and I change that. So I totally like just have like I'm like blindly believing that I'm going to be successful just because I believe in myself despite whatever's thrown my way. And looking at your steps, completing your doctorate and then moving on to the next journey, it's definitely inspiring. So,
Oh, well,
uh,
thank you. Thank you for sharing that. That was really insightful. It sounds like you're already doing an awesome job of, keeping that mindset, and you've already done so much. And I think that's one thing that's helped me is reflecting on, yes, I maybe have this many years left, but look how many I've already done. Look that
yeah,
I didn't even know if I would get into medical school. And now, I would be so proud of the fact that I'm in my top residency and stuff like that, and kind of being positive and, giving your past self encouragement to help
yeah.
your current self kind of get excited for the future, for sure.
Oh yeah, totally. Like looking back, what I wanted to be at is where I'm at right now. So
Yeah.
it's definitely in comparison. I've done the majority already, almost there. So the finish line's right there. So I have to keep that mindset positive. So you're 100% right. Can you tell the audience what challenges you have faced in the past as a leader?
Yeah, absolutely. So I think one big one that a lot of people probably have struggled with would be just taking on too much work or
Oh yeah,
responsibilities. And we've already talked about this a little bit, but I love everything. I want to be involved in everything. So while that diverse interest is something that I'm proud of, learning how to, say no to good opportunities or figure out a way to, decrease or make time rather for those new commitments is something that I've continued to work on.
good.
Um, so that's one big one. And then I guess the other part is like specifically within a group, I've also struggled a little bit with just taking on a little bit too much of the work, like going back to school during school projects and stuff like that. And unfortunately, that can kind of take away opportunities for other people to grow and gain experience. And if they were a part of that product in a bigger way, then, probably would have been better. And I think that's something that I hadn't reflected on until pretty recently, like the last 5 years or so, because I felt like I was, doing a service, that I
Yeah,
was doing more in this project. But I know now that, everyone should contribute so that they get those experiences as well.
100%. And I resonate with that a lot because at first in college, I always wanted to be the leader in
Hmm.
like group projects and whatnot. And then when I got to my master's, I sort of wanted to like take a step back and lay low. And when no one would like step forward after like a while, it would just resort to me volunteering.
I think some people are just, maybe not as confident or not not feeling as ready to take on a leadership role. And, that can be okay as well, but just making sure that, we're encouraging people to do that, which I know you do already, having worked with you. So, sometimes you got to be the leader, but just making sure those opportunities are there for other people as well.
I definitely like to have every department within the Brightside Productions, like there's a leader that runs the whole department. And I really like, trusting and relying on the other owners to pull their own weight and have, this system that's created between us. And when you like trust the people you work with, it makes things much more feasible. So we've talked a lot about the, challenges that leaders might have faced in the past, like yourself. So what are some other costs of assuming a leadership role?
I mean, we kind of touched on this, or at least alluded to it in the last question, but I think the two big ones that I've noticed are just time and stress. So, even things that are exciting, if, we take on too much, or, maybe we don't have the time to like fully commit to something, or even if we do, if it's just a stressful role, that can add a lot of stress that kind of goes throughout your life. So knowing how to manage that is really important. And then just time as well. Just making sure you still have time for yourself and time to, connect with your loved ones and do other things that are important to you as well.
Yeah, I agree. And I've had to work on balance a lot, with leadership because we wear so many different hats. And I'm sure this happens to you too, where it's like you have to switch from one perspective to another because they're different roles and requires different skill sets. And alternating between them, it's kind of like code switching if you think about it, like in terms of language. So that could get a little exhausting at the end of the day. And since we're involved in so many different projects, it's like we're being pulled in so many different directions. But at the end of the day, we love it. It's all about managing stress and, managing that time. And once you're able to do that in a balanced way, you're able to flourish and it doesn't feel like work. It feels like you're just doing your passions.
Yeah, that's absolutely right.
So, what are some of the benefits, turning it back into a positive note? What are some of the benefits of assuming a leadership role?
Loving that positive mindset. No, I mean, there's a ton of different positives, but I think, a few of them are just personal growth. So, whether that's professional for making connections and gaining experience, to, growth as a person and reflecting on, how can I be the best leader that I can be in this setting and in other settings. So the example of going, okay, I might be taking on too much. I might not be giving enough opportunities to other people. You wouldn't necessarily have that knowledge or that opportunity to reflect if you hadn't taken that leadership position.
Hmm.
And it might not be as evident in other factors of your life. I think another big one professionally is mentoring opportunities. And that kind of goes into the connections that you can make. But I've met some awesome mentors that, have really guided me and have kind of shown how to implement that work-life balance and everything. So
I agree. And as we've been mentored, we sort of pick up our own mentees as we go along and we sort of reflect who has mentored us, but we adapt it to our own styles. So, like, I've had to mentor people and mentoring them has made me better. It's
yeah,
evolved me. So, I definitely like agree with you that, you grow as a leader, you make connections, and with those connections come mentoring opportunities where you were once, being mentored by someone and now you're mentoring someone else.
yeah, absolutely.
So, what advice would you offer to others who are seeking to develop their leadership potential?
Um, I guess the advice I would have, and this kind of summarizes what we've talked about, but just really getting confident, becoming confident in yourself and in your success in the future, and being willing to go outside of your comfort zone because nobody feels completely ready to take on a new position or completely ready to go do a speech, for an elected position or something like that. So that's one part. And then I guess the other would just be really seeking feedback from your mentors. And then also through peers. I think sometimes people forget how valuable feedback from peers can be as well. Just, of course, take all feedback with a grain of salt and, kind of compare it to your own personal reflection of how you feel you're doing.
For sure. And especially when you hear these different perspectives and you sort of like build it into a system, that's factual, it sort of gives you a whole picture. So I agree with that. So for our next segment, Bright Talk, where we discuss complicated topics in hopes of shining light on the matter, this week we will be discussing mental health in healthcare providers. Why does it matter and what can we do about it? So, Dr. Shelby, why does mental health matter?
Yeah, I think this is such an important topic and one that's fortunately gotten a little bit more attention recently, but mental health is a crucial aspect of overall well-being and physical health as well. So, it affects how we think, how we feel and act, and really helps determine how we can handle stress, relate to others, and make healthy choices. Mental health plays a very significant role in every aspect of our life. And really influences our thoughts and interactions as well. It's basically connected to almost every facet and is really a driving force for the relationships that we have, even ones that are passing or, that might not be permanent relationships.
Yeah, for sure. And, a lot of people don't realize that mental health is basically a projection of your physical body, because mental health has to do with chemicals in your body. There could be a chemical imbalance. You have to investigate and identify, how your body functions, what's causing it to feel sad, what's causing it to feel anxious. There's so many things that you could identify, and mental health is very complex. So a lot of people, when they think mental health, they just think it's something that is for people that are unwell and need to be like, either Baker Act or are not as competent, but that's a stigma. So mental health is very important and it should definitely be put at the forefront.
No, I definitely agree with you. And I think there's so many different reasons for, various mental health concerns, but whether that's, a primary imbalance of chemicals where maybe, medication is needed to rectify that, or, like a thought process that might be hurting them, and kind of reframing thoughts and working on that, which I know all about. The physical aspect, definitely. There's definitely like a feedback cycle as well. So those are all great points.
Yeah, it's definitely all connected. So, as a provider in the healthcare field, what impacts mental health care providers?
Yeah, so we'll talk about some statistics in a minute, but healthcare professionals tend to face a higher risk of developing mental health issues compared to the general population, just due to the nature of their work. So they're pretty much, constantly exposed to people who are suffering and often have to deal with really difficult or emotional situations. So, we talked about this a little bit earlier, at least you alluded to it, that these elements can lead to burnout or compassion fatigue. And working conditions in healthcare often involve really stressful situations. And, if you're already burnt out and then you're having exposure to human suffering and death pretty regularly, and unique pressures from relationships with patients, family members, and employers, that can, grow to be a lot.
And, it really does force you to become a master of your own emotions, because you have to separate work from your personal life. And the moment you're, in those work hours and you leave, you have to sort of clear yourself of the energy that, if it was negative, clear yourself of that before you get home, and unpack that as well. So definitely a lot, when you put that into perspective. What symptoms or disorders would you say are the most common among healthcare providers as a result of this prolonged vicarious workplace exposure?
Yeah, so, I definitely want to hear your input as well with your,
Hmm.
professional experience, but I think what I've seen a lot are definitely anxiety and depression. And then, a lot of people suffer from trauma as well. So I don't know if you could touch a little bit on vicarious trauma. I know that you're more of an
Yeah.
expert in that.
No, yeah, totally. So, vicarious trauma consists of being exposed or hearing about or having an acknowledgement of a trauma that has occurred to someone that you know that's near you, or someone that you don't know, but you witnessed really, traumatic events, or are hearing about those traumatic events, it could sort of seep into you and those symptoms manifest through you. So you sort of embody this vicarious exposure that you're experiencing and could emulate, post-traumatic stress disorder or post-traumatic stress symptoms. It just depends on the person and the severity of the exposure that they have. Can you elaborate with some statistics as to, what healthcare providers experience because of the prolonged vicarious workplace exposure?
Yeah, absolutely. So, this is certainly in no way all encompassing, and there are a lot of, health professionals that I'm not talking about right now. And, I just want to acknowledge that obviously, this is true of everyone in the field, but, we have some pretty good statistics specifically on nurses, on residents, on physicians. So, depression in nurses has been estimated to occur at double the prevalence of the general population by the American Nursing Association. That's huge. That's a huge increase from the
Hmm.
general population. And then AAMC senior staff writer Stacy Weiner wrote that depression rates in medical residents have been estimated to be at 29%, and that's versus 8% in non-physician
Oh, wow.
populations. Yeah, so pretty striking. Fortunately, studies have shown recently that attending physicians, so physicians that have graduated residency and fellowship, have had rates that are more closely aligning with the general population now. So that's great. But in one 2020 study of emergency medicine providers, they show that 87% were dealing with increased stress due to COVID. But almost half of them didn't feel comfortable seeking treatment if needed. And, you know, we talked about stigma a little bit, but there's a
Hmm.
lot of fear, especially in healthcare providers, that, if they do seek mental health treatment or help, that, maybe their peers and their patients will think less of them. And that, there's this kind of ideology, which fortunately is getting better, that, medical providers need to be in perfect mental and physical health to provide care to people well. And that's obviously not true.
Yeah.
Nobody's perfect. Everybody has something, but people provide their best care when they do seek help, right? So,
Yeah. And especially during COVID-19, where a lot of like elective surgeries or elective fields were sort of being put on the back burner, and a lot of the pressure was being put on treating people with COVID. So, witnessing so much death at a rate that has not really been common
mhm.
in recent time definitely took a toll on a lot of healthcare professionals and moved a lot of people outside of, wanting to be a healthcare professional and moving outside of that mindset and seeking for other responsibilities, other jobs. So I definitely see this exposure being accumulated within these professionals. So, seeking mental health services to clear out all that exposure and to sort of vent, vocally, um, or just communicating with someone about what you're experiencing and letting that out, you could sort of clear that energy.
Yeah, absolutely. And actually, speaking of COVID and burnout, one very recent study on National Burnout Survey Series, co-authored by the AMA, showed that the COVID-19 pandemic worsened, just like you said, longstanding issues with U.S. physician burnout rates. And at the end of 2021, it showed that almost 63% of physicians reported symptoms of burnout. And that's an increase from 38% in 2020.
Oh,
So,
wow.
yeah. So, that really emphasizes what you were just talking about now.
You mentioned a lot of great statistics, but why should other people that are not healthcare providers like care about this? Why does this even matter?
Yeah, absolutely. So, besides just on an individual level, wanting everybody to be their healthiest physically and mentally, this really does have impacts on a structural level. So, according to a CHG healthcare survey of over 500 doctors, over 50% of those physicians either retired or changed professions during COVID. So this is a really stark contrast to the typical turnover rate, which is usually 6 to 7% previously quoted by the AAMC. Unfortunately,
Wow.
we're also losing healthcare providers to forcibly. So, physicians die from suicide at double the rate of the general population.
Whoa.
Yeah. So, fortunately, those numbers are falling a little bit closer to the general public on recent surveys. But that's a pretty striking uh,
Yeah. That's
data point.
scary. That's
It
scary.
is scary. And that affects us on obviously an individual level where we want to prevent that at all costs, but it also affects us on a structural level, because we're continuing to lose providers and to lose support systems. And kind of going back to nursing a little bit, I don't want to forget about our awesome nurses here.
Yeah.
Data from the CDC and Prevention National Violent Death Reporting System, as discussed by Ms. Lee and Dr. Friesen, deaths by suicide among registered nurses. They found that nurses were 18% more likely to die by suicide when compared to the general population. And of note, female nurses were particularly at risk, where the death of suicide was nearly double that of the general population as well, and 7% more likely than female doctors, actually. So,
Wow. So when you put all of this into perspective, it really does matter because if everyone, a lot of lives are being lost, to have double the rate physicians and nurses, not to mention all the other healthcare professionals that are out there. We haven't mentioned those statistics, but just highlighting the majority with physicians and nurses, that shows that they're 2 times more likely to engage in suicide than the general population. And then the cycle of knowledge, like there's reports that have been showing that many people don't pursue doctorates now. So they're not trying to be in, the medical field as an MD, or they're pursuing other alternatives because of the consequences that come.
yeah, no, I think those are all really good points. And, even the providers that we do have that did still stay in the profession, when they're struggling with burnout or, compassion fatigue or other, mental health concerns, they're really, that's impacting their ability to care for others well. And, that's going to affect the care that you receive. And, when it gets severe enough, can, have significant consequences for both the provider and for the patient. So we definitely would want to avoid that.
Yeah.
And then I won't read the whole quote, but one thing that I really liked from Dr. Kirch, who is part of NAM and the AAMC, was just really talking about how stigma can cost lives. And that's really true, unfortunately. And I think just being open about sharing personal struggles and, making structural changes and decreasing stigma on a global level is all going to be really beneficial in, improving those outcomes.
Yeah, totally. So we definitely have to look at both sides. So starting off from the healthcare provider's perspective, what can mental health providers do to improve their mental health while still doing the job they love?
Yeah, I think, continuing to raise awareness of mental health issues and just really eliminating barriers to accessing care. And then identifying workplace and community support for healthcare workers. So, I think there's been an awesome movement recently about, promoting mental health and being advocates for mental health. And I love that. I think that's really beneficial. But sometimes, especially as providers, we fail to apply that to ourselves and to our peers and colleagues. And so, we want all of our patients and our family to, be getting the care that they need and being their healthiest selves. But for whatever reason, when it comes to providers, they don't give themselves that same grace. And so
Mm-hmm.
I think really within the healthcare system, promoting that as well and just decreasing stigma related to seeking and receiving care for mental health. There's some fear in healthcare providers, and especially in like medical students and residents and all of that, if they do seek care, that it'll show up on their record somehow and that it'll affect them. So I think just transparency about what that means with this, within our system, and really reassuring people that for the grand majority of care, it would be completely, not affecting your professional career.
Yeah, yeah, I totally agree. And you emphasize transparency, and transparency is very important because if we are afraid to speak about things, then, we won't know until we communicate. And communicating also could bring a sense of relief. Like if they're also on board with mental health is cool, mental health is something that I engage in, we're aligned. And if it is otherwise, like you're able to break that barrier of like the forbidden taboo, information that you're like discussing, and you're starting to discuss it, and it could unwind into something beautiful where you end up connecting. So, for instance, like I've gone to therapy a lot, and in college, I needed it a lot to be able to even complete my first degree. As a first generation student, I was like, wait, I did not understand what college was truly going to be like until I got there. And when I got there, it was beyond my expectations, and it only got even more difficult as time went on. But as time went on, my skills and knowledge increased, and then I got more competent. So I definitely needed therapy to learn from professionals. You go to people that are experts in these fields, and you interact with them, and you sort of turn it into where you're the case study. You are the patient. They are investigating you. You are the focus. And when someone puts that attention and that care towards you, you're able to flourish because someone else could help you identify or lead you to identifying yourself, um, what the troubles in your life are, and venting that out and communicating. And if you share with your friends or even colleagues of personal experiences, you're destigmatizing mental health. You're really making it more transparent to where they are more likely to contemplate it now. They're in the pre-contemplation phase, which is like you're exposed to something and you start to like debate it, which leads to a contemplation where you're really like embodying it a little bit or like debating it, and it leads to maybe you taking steps to it where you're planning and then you go into action mode. I'm talking about the trans theoretical model for behavioral change. So, you know, we all have our different experiences and exposures, and it makes us who we are. And unpacking that and identifying that, that is what you ultimately get from mental health services and understanding your body and mind. So definitely encouraging it within providers. So what could be done for healthcare providers to better engage in positive mental health practices?
Yeah, so, I think we touched on this a little bit, but just really advancing a culture of engagement. It's important to make successful engagement a priority at really every level of the mental health care system. And this includes really training for it and, supporting it and measuring it. So, it's great to create a more positive environment, but we also have to put in, some structure to saying, hey, let's check in with our healthcare providers and, see if there's anything that we need to discuss. And it's also really crucial to, communicate about hope and share information and decision making and treat people with respect and dignity. So,
Yeah.
just using a strength-based approach for assessment and services creates a more, I guess, positive experience for the patient. And I think just in general, whether, it's for a healthcare provider or not, I think, just trying to view and promote the idea that, mental health concerns are things that, need to be talked about and need to be seen for. Like if somebody broke their leg or they had high blood pressure, most people hopefully are going to go to the doctor about a broken leg and, maybe wear a cast, maybe not, and figure out what they need for it. And people are pretty open to that most of the time. But, for whatever reason, that's not true of mental health. So
Yeah.
working towards kind of equalizing those fields.
Yeah, and especially when you have so many different cultures and the programming sort of that goes along with that culture that's embedded into people. And when you have to expose yourself to other cultures, you sort of open your mind to other possibilities. Definitely communication is very important, but just to like elaborate a little bit more on that, what could society as a whole do for this issue?
Yeah, no, that's a great question. I think overall just advocating for change on a political and structural level and just continuing to raise awareness. So, some efforts have been done already. For example, during COVID, President Biden signed into law the Dr. Lorna Breen Healthcare Provider Protection Act, which actually did a lot of different things. But one of them was getting relief funding and policies that allowed physicians to adjust to administrative requirements during the pandemic. So, that's one example of the change that can occur when we're able to, advocate and have our voices heard at a national level. Other things to, advocate for would be, increasing nursing salaries, like better nurse to patient ratios. There's a lot that, needs to be brought up. And so I guess just really, promoting that and getting in touch with local and national politicians to secure those changes.
Yeah, we definitely got to protect each other. So the people that take care of us also need protecting. So if we definitely unite as society and push this forward, we could definitely implement this to have a very strong healthcare system that isn't being depleted or doesn't have a mounting pressure that's crippling it. So if we work together, we could definitely push forward a healthier mindset among our healthcare providers. Thank you so much for such an insightful interview and Bright Talk segment. I am super excited that for episode 3 now, we get to co-host together. So we're switching things up. And we will be interviewing Luke Riosti, our Chief Creative Officer.
Yeah, I'm looking forward to it.
Yeah, same. So thank you guys for tuning in. Until next time, take care.
Bye now.
Episode 1 and 2 was executive produced by Richard Brito, Shelby Flohr, Luke Riosti, Jake Riosti, Andres Gil Arana, Zoe Brzezinski, John Scrivenage, and Sophia Pius. Music by Jake Riosti. Edited by Luke Riosti and Richard Brito.